Welcome to Holmes on Health, the podcast where nutrition, fitness, and hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies that help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, or already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello, everyone. I'm Dr. Alan Holmes, and welcome to another episode of Holmes on Health. So October has been Breast Cancer Awareness Month, and although we're coming to the end of the month, I still felt we should talk about the topic of breast cancer. We've talked about it some as related to hormone replacement therapy, but I wanted to go a bit deeper in this dive because this is something that affects millions of women, and it has largely been completely misunderstood for the last 2 decades. Every week in my clinic, women walk into the clinic, and they're somewhere between confused and concerned. Yet, they always seem to be desperate for help. That's because they're having hot flashes so bad they can't sleep. They're experiencing brain fog that's so thick that they forget why they even drove to the grocery store. And their libido, well, it's gone. Their muscle mass is disappearing. Their bone density is dropping. And they've heard that hormone therapy might help, but the doctors have told them, you're going to get breast cancer. And that's where the confusion comes in, and that's where the concern comes in. This fear is based on a quite misunderstood study that we've mentioned here before, done back in 2002, called the Women's Health Initiative. And that's where the damage was done, and it's been existing ever since. So again, given that October is Breast Cancer Awareness Month, I figured it was a good time to try to set the record straight, not just about estrogen, but about all the sex hormones that women need, meaning estrogen, progesterone, and testosterone. So we're going to take a dive into this today, and we're going to try to figure out why the fear is misplaced. And yes, we're even going to talk about hormone therapy after breast cancer and hormone therapy even if you carry the BRCA gene. The conversation is changing, which is a good thing, because women deserve better. And they don't need to be suffering the way they're suffering because of outdated headlines. So let's get into it. So 2002, the Women's Health Initiative study drops and the headlines go nuclear. Estrogen causes breast cancer. Stop hormone therapy immediately. The doctors panicked. The women panicked. Prescriptions plummeted overnight. But there's a few things those headlines didn't tell you. The first is that the average age of the woman in that study was 63. Many of them had multiple comorbidities, meaning some of them were smokers. They were diabetics. They had blood pressure issues. They were obese. So they didn't really pick a healthy crowd to study. The second thing is that they were not using bioidentical hormones. They were using Premarin, which is literally pregnant mare's urine, and using Provera, which is a synthetic progestin that your body doesn't really even recognize as progesterone. The third thing is that the estrogen-only group, meaning the group that only received Premarin, had no increased risk of breast cancer. In fact, some of the analysis showed there was actually a slight decrease. And fourth, the group with the tiny uptick, the ones taking synthetic progestin, they were not taking progesterone. It's a different drug, works on different receptors for a different outcome. But did the media report any of these nuances? No, they did not. They simply just said hormones are bad with their very, very loud megaphones. And you know what happened? Cardiovascular disease in women went up. Hip fractures went up. Dementia rates went up. Quality of life went down. All because we scared women away from the hormones their bodies needed. So let's start with talking about estrogen, specifically estradiol. What does it actually do? Because, spoiler alert, it's actually protective. Balanced estradiol repairs DNA damage in cells before they can even become problematic. It reduces inflammation, which is a way bigger cause of cancer. than estrogen is. It improves insulin sensitivity. It maintains healthy cell differentiation as the cells mature, and this keeps them from going rogue. When estrogen crashes in menopause, inflammation rises, some resistance rises, oxidative stress rises, central fat accumulation rises. Yes, that pooch that you may have developed out of nowhere, even though you're still in the gym and trying to eat right, it's in part lack of estradiol. And guess what all those things increase? Your cancer risk, as well as your risk of heart disease and Alzheimer's disease. The absence of estrogen after menopause is the problem, not restoring it with bioidentical estradiol, which is not the problem. So what about progesterone? Well, it gets interesting here because in a perfect world, estrogen doesn't work alone. Your body never meant for that to be the way it was. You also need progesterone. And when I say progesterone, I'm talking about real progesterone, micronized bioidentical progesterone, not synthetic progesterones. And this is huge. Progesterone and progestins are not the same thing, and any doctor that says that they are is simply wrong. Back to the Women's Health Initiative study. The group that showed an increased risk was taking medroxyprogesterone acetate, brand name Provera. It is a synthetic progestin that activates androgen and glucocorticoid receptors, increasing cell proliferation. Bioidentical progesterone is completely different. It decreases proliferation of breast tissue. It promotes apoptosis, which means programmed death of abnormal cells. So that's a good thing. It balances estrogen so that the cells mature properly instead of growing out of control. In the ERIN French cohort study that followed over 80,000 women for years, women using estrogen plus micronized progesterone, no increased risk of breast cancer. Women using estrogen plus synthetic progestins, there was a bit of an increased risk. Same estrogen, different progesterone compound. Completely different outcomes. But progesterone isn't just about breast protection, even though it does do that. Progesterone also improves sleep. It has anti-anxiety effects. It supports bone building. It helps maintain insulin sensitivity. It is healthy for your blood vessels and your blood pressure. The molecule matters. The receptors it binds to matter. Let's move on to testosterone. So this one makes people really uncomfortable. And usually the first question is, isn't testosterone just for men? Not true. Testosterone is for humans, whether men or women. Women make it, just in smaller amounts compared to the guys. And here's what the research shows. Testosterone has anti-proliferative effects on breast tissue. It opposes estrogen-driven proliferation. So, studies by Glasser found that women using bioidentical testosterone, along with estradiol, had lower rates of breast cancer than expected. Testosterone did not increase risk of breast cancer. It actually potentially decreases it. And there are studies ongoing also by Rebecca Glasser, where she is using testosterone to treat breast cancer patients. So testosterone, when used appropriately, it restores energy and vitality. It builds lean muscle. It enhances insulin sensitivity. It improves libido, and it protects breast tissue. But most doctors won't even test a woman's testosterone levels, let alone prescribe it. They will say, well, there's not any approved indication in females. Why? It's because there's a lack of education and there are outdated assumptions. So here's what you need to understand. This isn't just about more hormones. It's about restoring what your body used to make naturally. Because when estrogen and progesterone and testosterone are optimized together, here's what happens. Breast tissue stays healthy. Metabolism improves. Inflammation decreases. Bone and muscle are preserved. Sleep, mood, energy, better. Quality of life restored. And when you pair hormone balance with these three hormones, with strength training, adequate protein intake, quality sleep, and stress management, well, that's what creates real lasting protection. So What actually does cause breast cancer? What actually does increase breast cancer risk? Chronic inflammation, insulin resistance, metabolic dysfunction, excessive alcohol use, sedentary lifestyle, muscle loss, chronic stress, poor sleep. Those are the real culprits, not the hormones. Now, some of you are probably thinking that's all well and good, but I've had breast cancer. Or maybe you're thinking, but I'm BRCA gene positive. These rules can't apply to me. Well, for decades, the message was clear. If you had breast cancer or you carry the BRCA hormone, hormones are off the table forever. End of story. But that blanket rule was based on, again, fear, not science. So what about breast cancer survivors? In 2024, there was a review by Levi and Simon that argued that blanket contraindications should be reconsidered, especially for early stage cancers that were treated successfully. Women with severe quality of life symptoms, when bioidentical formulations are used under close supervision, observational data from European cohorts show that some survivors using bioidentical estradiol do not have higher recurrence rates. And there are numerous other studies with similar findings. Now, this is not to say all survivors can safely use hormones. I'm not saying that. The tumor type matters. The estrogen receptor, progesterone receptor status matters. The stage of the cancer matters. The treatment history matters. So I'm not saying HRT for every breast cancer survival. Like with most things in medicine, it's more nuanced than that. But what I am saying is the conversation needs to be individualized, not an automatic no. What about BRCA carriers? So the data is really actually quite interesting here. There was several large European studies that showed that in BRCA positive women who've had risk-reducing oophorectomies, meaning surgical menopause, menopausal hormone therapy does not increase breast cancer incidence compared to non-users. BRCA carriers who use hormone therapy after ovary removal aren't seeing higher cancer rates than those who don't. So this is saying that one of the high-risk groups for breast cancer, BRCA gene positive, do not have more incidence of breast cancer if they go on hormones. That's huge. Now, why is that? Because the risk comes from a genetic mutation, not from restoring hormone levels. So what does safe look like? Well, it's personalized risk stratification. What type of cancer? What stage was it in? How long ago has it been since you were treated? What treatments were used? How severe are your symptoms of menopause? What are your other metabolic risk factors? Then, if considered, most certainly bioidentical formulations only, regular monitoring, comprehensive metabolic optimization. It's all about shared decision-making, where you understand the risks, the benefits, and making an informed choice about your own body. Meaning, it is, again, should not be said because you have a history of cancer or because you are BRCA gene positive, it is a hard no on hormones. Because I believe other things should be considered. Even if there was a slight increased risk chance of breast cancer, which I would never want a woman to get breast cancer if possible, but we must also consider, what about hip fractures? What about cardiovascular disease? What about Alzheimer's dementia? What about these other things that we know hormone replacement therapy are protective against? Are we just going to throw all those risk reductive therapies out the window only to focus on breast cancer and the prevention of breast cancer? Maybe that's the right answer for you. Maybe it's not. But I think the conversation should be had. That's the point. Whether or not you use hormone therapy, I just want to go kind of 30,000 foot view, step away from hormones for a second. Every woman should get annual mammograms or MRIs based on their risk. You should know your family history and your genetics. You should, to the very best possible way, become metabolic optimized. You should monitor your fasting insulin, not just your glucose. You should track inflammatory markers. You should get DEXA scans to see about bone density. All of these other pieces of data, these other pieces of information are very, very important in helping you make your informed decision. What about lifestyle? What are the foundations? You should be doing resistance training 3 to 4 times a week. Why? Because increased lean muscle mass leads to better metabolism and better insulin sensitivity. You should be getting an adequate amount of protein. Again, my recommendation is 0.8 to 1 gram per pound of ideal body weight. Why? It helps maintain lean muscle mass, improves metabolism, keeps your cells insulin sensitive. Quality sleep matters, 7 to 9 hours. Stress management matters. You should at least think about your alcohol intake. I'm not saying that everyone should be a teetotaler. I'm just saying that in the best case scenario, alcohol is probably not helping. And so limiting it somewhat to limit the potential risk of alcohol intake may be a wise thing to do, particularly if you have other risk factors that put you at increased risk. So think of this as an integrated protection plan. It's not just one intervention, but it's a comprehensive strategy. Because inflammation, insulin resistance, metabolic dysfunction, they are absolutely bigger cancer drivers than bioidentical hormone replacement therapy. So here's what I want you to remember. 1, estrogen doesn't cause breast cancer. Bioidentical estradiol is protective when properly used. 2, you need all 3 hormones. Estrogen, progesterone, and testosterone. They work together. Your body never meant for estrogen to work alone. 3, synthetic progestins are what caused the problem in 2002, not bioidentical progesterone. 4, even after breast cancer or even with BRCA gene positive status, hormones are not universally forbidden. The science is vastly more nuanced than that, and decisions should be individualized and based on evidence-based medicine and informed consent. 5, focus on what actually drives cancer risk: inflammation, insulin resistance, metabolic dysfunction, sedentary lifestyle. Here's the deal. You were lied to. You were scared unnecessarily. And you deserve better than suffering through menopause because someone misread a headline 23 years ago. Hormone therapy, when done right, meaning bioidentical hormones combined with comprehensive metabolic optimization, becomes a part of longevity strategy, not a risk factor. Please share this with one woman, or maybe many women, that you may know who needs to hear this. Send it to your group chat, because somewhere right now, there's at least one woman, in reality it's many, many women, lying awake at 3 a.m., thinking they just have to suffer through it. Thank you for listening. I really appreciate you being here. I hope this was valuable to you. If you want to hear more, you can always follow me at Alan J. Holmes, MD on Instagram, or tune into the podcast. Like, subscribe, and always live life optimized. Thank you for tuning into this episode of Holmes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes, MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice. And no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.